If you've been told your cholesterol is too high, and you've also been dealing with erectile dysfunction, there is a connection that is often not clearly explained. These are not two separate problems. They are the same underlying issue, showing up in two different parts of your body. And here is why this matters. This type of erectile dysfunction, the kind linked to blood vessel health, is one of the most reversible forms. In this video, we'll explain exactly how cholesterol affects erection quality, what the research shows, and what you can do to improve it. Why high cholesterol causes ED. Let's start with the basics and keep it simple. To get an erection, your body needs blood to flow into the penile tissue. That flow is controlled by small arteries, blood vessels that need to be relaxed, flexible, and open. When everything is working correctly, your body produces a natural molecule called nitric oxide. Think of nitric oxide as a signal that tells those blood vessels to open and allow blood to flow in. No nitric oxide signal, no blood flow. No blood flow, no erection. Now, here's where high cholesterol enters the picture. When LDL, often referred to as bad cholesterol, is elevated in your blood, it begins to damage the inner lining of those small arteries. Not just the arteries near your heart, but the ones that supply blood to the penis as well. That damage interferes with your body's ability to produce nitric oxide. Less nitric oxide means reduced blood flow. And that is the direct biological connection between high cholesterol and erectile dysfunction. Can this actually be reversed? Now, the most important question, can this actually be reversed? The research answer is yes. For men where high cholesterol is a significant contributing factor, there is real potential for improvement. In one clinical study, men who reduced their cholesterol through diet alone saw meaningful improvements in sexual function. Some even returned to normal function, not slightly improved, normal. Other research has shown that lowering LDL cholesterol can improve erectile function even without medication. And large meta-analyses, which combine results from multiple clinical trials, have consistently found that treating high cholesterol leads to measurable improvements in erectile function. The biology supports this. When the underlying cause is addressed, blood vessel function can improve, nitric oxide production can recover, and blood flow can return. This is not speculation. It is documented, published science. So, how do you actually reverse this? Let's walk through three key pillars. Step 1 is diet. And this is where a large part of the improvement can happen. The goal is simple. Reduce the foods that damage your blood vessels and increase the foods that help them recover. Let's start with what to reduce. Processed foods, fried foods, red meat, and full-fat dairy. These are common dietary sources of LDL, often referred to as bad cholesterol. Now, what should you increase? Fiber-rich foods, such as oats, beans, and lentils. These help remove LDL from the bloodstream. Omega-3 rich foods, like salmon, sardines, walnuts, and flaxseed, help reduce inflammation in blood vessel walls. And certain plant foods, including leafy greens, beets, and pomegranate, are especially useful because they support your body's ability to produce nitric oxide, the molecule that helps blood vessels relax and supports healthy blood flow. Research on the Mediterranean-style diet, which includes many of these foods, shows that it is one of the most effective dietary patterns for improving both cholesterol levels and erectile function. Step 2, exercise for vascular ED. Step 2 is exercise, and the research here is quite specific about what works best. Aerobic exercise, such as walking, cycling, swimming, or jogging, has the strongest evidence for improving both cholesterol levels and erectile function. The target supported by research is 30 to 45 minutes of moderate aerobic exercise at least 3 to 4 times per week. So, how does it work? Aerobic exercise increases HDL, often called good cholesterol, which helps protect your blood vessels. It also improves how efficiently your blood vessels function, helping them produce more nitric oxide, and that directly supports blood flow. One clinical study found that men who began regular aerobic exercise showed significant improvement in erectile function within about 12 weeks. You don't need a gym, you need consistency. Step 3 is medical support, and this is an important one. If your LDL cholesterol is significantly elevated, lifestyle changes alone may not always bring it down to the level needed for your blood vessels to recover fully. This is where a conversation with your doctor about medication, particularly statins, becomes relevant. Here is something that often surprises many men. Research consistently shows that in men whose erectile dysfunction is linked to high LDL, statins tend to improve erectile function, not worsen it. In one large analysis, men receiving statin therapy showed around a 25% improvement in erectile function scores. The reason is straightforward. By lowering LDL levels, statins give damaged blood vessel walls the opportunity to begin healing, and as those vessels recover, the nitric oxide pathway, which supports erections, can begin to function more effectively. This does not mean everyone needs medication, but if your doctor has recommended it and you've been hesitant, this is worth understanding. Recovery timeline. Let's talk about realistic expectations, because this is important. Recovery from cholesterol-related erectile dysfunction does not happen overnight, but it is measurable, and it tends to follow a predictable pattern. In the first 1 to 3 months, blood vessel function begins to respond to improved cholesterol levels. Inflammation reduces, and nitric oxide signaling starts to improve. Between 3 and 6 months, many men begin to notice clear improvements in erection quality, stronger erections, and more consistent responses. At 6 to 12 months, for men who remain consistent, research shows significant improvement in overall erectile function. The men who see the best results are those who combine all 3 steps: diet, exercise, and appropriate medical support, rather than relying on just one. Your next step. To summarize what we've covered, high cholesterol can damage the small blood vessels that control erections by reducing the body's ability to produce nitric oxide. This is known as vascular erectile dysfunction, and unlike many other causes, it has a clear, evidence-based path to improvement. That path has 3 key components: a cholesterol-lowering diet, regular aerobic exercise, and, where appropriate, medical support. If you'd like a more structured approach, ErectoGuide is a step-by-step digital program designed specifically for men with vascular or metabolic causes of erectile dysfunction. It brings together the full protocol, including diet, exercise, clinical targets, and what to discuss with your doctor, in one clear, organized guide. You'll find the link in the description below. Take the first step.